So what is CHS?
Sure. So CHS, or Cannabinoid Hyperemesis Syndrome, is a disease process that we're seeing more and more commonly, and people are coming in with repetitive episodes of nausea, vomiting, upper abdominal pain, and in some cases profound dehydration. And it's usually associated with repetitive use of marijuana products.
So this is something that you would more likely see in someone who has kind of been a consistent user?
Yes, so this is something that we're seeing in individuals who are daily users of marijuana, and oftentimes for a number of years.
What is it about CHS that makes it different from something else that could also, induce this type of nausea?
Yes, that's a really good question. So there are certainly a lot of other causes of nausea and vomiting, but one of the hallmarks is that the condition will almost completely resolve in individuals who completely stop using marijuana products, as opposed to certain other conditions where they will have continuous nausea and vomiting in the absence of any marijuana use.
Is there something about CHS that if a patient were to walk in the doors of your ER and presents with these types of symptoms, you now know quicker, I guess, than before that, hey, this might be what it is?
Sure. So, we, of course, in the emergency department need to rule out any life-threatening emergencies. Typically, CHS is not life-threatening unless someone becomes profoundly dehydrated, which can happen, but we need to certainly rule out any other possible surgical causes or something that we can reverse. It is a clinical diagnosis, meaning that there aren't any specific tests that tell us that it is exactly what's going on. But there are a few key characteristics, such as daily marijuana use, recurrent episodes within 24 hours of use of marijuana, and then also some patients report temporary relief with taking very hot showers or baths. And so that does sometimes cue us into this being the cause of their symptoms.
How often are you now seeing this in your emergency department?
I don't have any specific numbers because sometimes patients come in with very vague symptoms and we don't always know retrospectively that that's what's going on. But I would say anecdotally that we're seeing it at least on a weekly basis, if not sometimes daily.
We were kind of talking before just about overall awareness. How do you think that's changed with CHS over the past few years?
That's a really good question. So CHS was first described in 2004, so it's been over 20 years since it was first described in the medical literature, but for some reason it has not been widely popularized until over the past few years. There's been more research, especially just prior to COVID. There were quite a few papers that came out about it, and I think that increased the awareness. But one of the other things that we're seeing is with the legalization of marijuana in many states, we're seeing an increased number of patients with CHS, especially given the high potency of legalized marijuana products.
Anecdotally talking to these patients, are you finding that they're smoking it more? Are they, taking things like gummies or other means of ingesting it, or is it kind of just in general cannabis?
Yeah, so I would say it applies to patients who are using all different forms of cannabis, but we have noticed that it is in patients who are smoking cannabis are more likely to develop this. But oftentimes, people who are daily users are both smoking and taking edible marijuana products.
Is it common for a patient to have some of these symptoms and go a while before they figure out that it is CHS?
Yeah, this is one of those disease processes that can go undiagnosed for a very long time, mostly because there aren't any specific tests to to diagnose it with, and so patients can sometimes go months or even years without a formal diagnosis.
Now it is something too, from the medical standpoint, when you have a patient present with this, you can now code for it.
Yes, there are now ICD-10 codes for Cannabinoid Hyperemesis Syndrome, and I think more and more physicians are recognizing that and documenting that, so I think moving forward we'll be seeing a little bit more helpful data to back up the number of presentations that we've been seeing.
And I know you mentioned like the advice is to stop smoking, right? To stop having cannabis and to stop taking cannabis products. How soon should that relieve someone's symptoms?
Yeah, that's a really important point. So there was one study that showed that 97% of patients with CHS had complete relief of their symptoms after they stopped using any cannabis products. Now, patients who are having an acute exacerbation of CHS can have symptoms that last up to a couple of days, and in rare cases can even persist for several weeks. And so we would say that the most important thing is to immediately stop using any cannabis products. After that, most patients will have complete relief of their symptoms within 24 to 48 hours.
And beyond just cannabis, is there anything else in someone's diet, that maybe they should steer away from or stop having after being diagnosed with CHS?
Well, really the marijuana and the cannabinoids are the main cause of the issue. Now, oftentimes patients may not also be healthy in other aspects of their life, maybe using other illicit substances like other drugs, or maybe not eating as well as they perhaps should be. But it's really the cessation of marijuana that's going to be the most important component of treatment.
Why is that important to be able, from your standpoint, to have something in your system where you can label what this is, and does that give you a better picture of kind of what's going on, not only here, but maybe across the country?
Absolutely. So having the diagnosis code that we can code for is going to be very important moving forward in terms of researching, so we can get a real accurate number. As it is, there's an estimated 2.75 or just under 3 million patients per year who have cannabinoid hyperemesis syndrome, and I think that the number is probably a lot higher than that. And I think with being able to code for it with the latest iteration of what's called the ICD-10 codes, we'll be able to get a more accurate number to put to that. So I think it'll be helpful for those patients who are suffering that we can identify it and then recommend the prescribed treatment, which would be immediate cessation of any cannabis products.
Does someone who has this, always come to the emergency department for treatment, or if they stop smoking, are they going to get better at home?
Yeah, that's a great question. Now, I can't talk about the patients who I don't see in the emergency department, so it's hard to really estimate. I'm sure that there are some patients who don't end up coming in because they have more mild symptoms, but we do see patients who are having countless episodes of nausea and vomiting and do end up presenting to see us. And so, we're certainly seeing probably a fraction of the patients who are suffering from this. There was one study that showed that in 1996, compared to when the study was published in 2017, the percentage of THC, which is the main active ingredient in marijuana products, has drastically gone up from 4% to 17%. And now it's estimated that in products that are in states where it's legal to have cannabis, that some of the THC percentages exceed 20%. And so the marijuana that people smoked or consumed even 20 or 30 years ago is very different from what's being sold today.
And here in North Carolina, something that we've done some other stories about is just you don't really know exactly what's on the shelves in some of these stores. Does that factor into this as well?
100%. So in North Carolina, any of the products that you could buy over the counter, whether it's Delta 8 or Delta 9, which are the two most common derivatives that we're seeing, are completely unregulated. And so in a package, even though it might say 10 milligrams or 20 milligrams, you don't really know what you're getting because, again, it's not under any government regulation, not looked at by the FDA. And so you may have one edible in the same package as another edible, and it has a completely different percentage of THC in it. We're seeing an influx of legal marijuana products from those states into North Carolina and states where it's not currently legal. And so that's, I think, accounting for some of the increase in presentations that we're seeing in the emergency department.
Is this, I know the word that gets sometimes used with marijuana use is overdose, right? What are your thoughts on this when it comes to having something like CHS?
Yeah, I think that, I don't know if I would use the word overdose. I feel like that has certain connotations. So we're seeing it in patients who may even just have taken one edible or maybe just smoked one time. And so it can affect patients who are very habitual users of marijuana and not even taking an excessive amount. And so what happens on a more scientific level is there's a change in their body's receptors in both the brain and the intestinal system from chronic use, and it's basically wreaking havoc on those receptors and causing those symptoms. So it's even with small amounts that those individuals are developing symptoms.
Inside the body, what is it that then induces this vomiting and these showers, or relief from showers and things like that? What's going on inside?
Yeah, so to be honest with you, there's not really great, there aren't really great explanations for it. We all have what are called endocannabinoid receptors in our brain and intestinal system. And for some reason, there are certain patients who use marijuana products on a more daily basis who have a downregulation of these receptors, so they don't function as they're normally supposed to. And within the GI system, that could induce a lot of intestinal spasms and can probably cause some of the symptoms that we're seeing, like upper abdominal pain, nausea, and vomiting. In terms of why hot showers work for some patients, it's not really well understood at this point, and I think that a lot more research needs to be done to try to figure that out. So the main thing that once we identify that this might be a cause of a patient's presentation in the emergency department, is we want to check blood work to look for any significant dehydration or electrolyte abnormalities, which we can see with a lot of vomiting. And so administering IV fluids is really important, especially if they're not able to keep anything down. We also recommend certain anti-nausea medications. Some of our more classic medications don't always work for some reason, and so we do rely on other medications that seem to interact with the dopamine receptors in the brain, and those, for whatever reason, seem to have a better effect. And then one other thing that also is unclear as to why it works is we try to apply capsaicin cream on the abdomen. That also does provide some temporary relief. Most patients with CHS don't end up requiring hospitalization, and once their symptoms are improved, we are typically able to discharge them home, oftentimes with a prescription for nausea medication and instructions to cease any use of cannabis, because that's just going to unfortunately continue to exacerbate the problem.
Do you see a difference in how this impacts someone who's older versus someone who's, say, maybe in their 20s?
I would say that we're seeing the majority of these cases in younger adolescent males. Not to say that it couldn't affect anyone, but we've been seeing it mostly in older teenage boys and young adults is the most common age range and demographic that we're seeing this. I hope that by doing this that more people will be familiar with it. And again, one of the problems is that some patients do get temporary relief from smoking again. So once we discharge them, they'll smoke because it makes them feel better for a short period of time, and then it's just going to continue to promulgate the issue and make it worse. And unfortunately, it's the same patients who are coming in over and over again. So I think that it's going to continue to become more prevalent, especially with legalization of marijuana in many states. And so something to be cognizant of and to really reconsider use of marijuana.